Antipsychotic medication. So description said, improve the thought process and behavior of the client with psychotic symptom, especially the client with schizophrenia. So schizophrenia is a mental disorder characterized by delusion, hallucination, disorganized thoughts, speech, and behavior, right? So typical antipsychotic are more effective for positive symptoms of schizophrenia, such as hallucination, aggression, delusion. So if you ask me, what is positive schizophrenia symptom, right? So positive symptoms means definitely schizophrenia is a serious mental disorder in which people interpret or misperception or misbelief or no relation with reality. Schizophrenia may result in some combination of hallucination, delusion, or extremely disordered thinking and behavior that is impaired the daily function or can be disabling. So this is typical antipsychotic medication also block the chemoreceptor trigger zone and vomiting center in the brain and producing an antiemetics effect. Atypical antipsychotic are more effective for the negative symptoms of schizophrenia, such as evolution, apathy, and alogia. So when patients have evolution, apathy, or alogia, we call negative symptom, and they need atypical antipsychotic. Atypical antipsychotic means clozapine, risperidone, aripiprazole, or olanzapine. But typical antipsychotic are more good for positive symptoms, like positive symptoms, schizophrenia, like who have delusion, illusion, aggression, or hallucination. Like most common typical psychotic are phenothiazine, thorazine, or promethazine, comprazine, right? So now let me go back here. So in this two column or table, you can say typical antipsychotic. Typical antipsychotic, also called first generation antipsychotic. So if you have hallucination because of schizophrenia, you might need haloperidol, means you must need first generation antipsychotic or typical antipsychotic. The most common drugs we use chlorpromazine, also it is called corazine, haloperidol, or it is called halodol, or domperidol, right? So other drugs, I said loxapine or thorazine or thioperidazine, comprazine, or promethazine. Most of medication we use orally or intravenous or intramuscular. So Phenothiazine are typical antipsychotic. Typical psychic drugs based on positive psychiatric symptom. And it is called first generation, right? What next? Next here, atypical antipsychotic. It is called second generation, right? Second generation atypical antipsychotics are atypical antipsychotics are also known as second generation antipsychotic. Example, clozapine, risperidone, aripiprazole, olanzapine, and quetiapine. Most common drugs, I said. Let me recap one more time. Aripiprazole, clozapine, olanzapine, quetiapine, risperidone. So they are drugs used schizophrenia or control the positive and negative symptom both. So most of these drugs end with prine, P-R-I-N-E, like olanzapine, quetiapine, clonazine, risperidone, and aripiprazole. The bad news of these drugs, atypical antipsychotics still have A, B, C, D side effect. A for altered vital sign, B for blur of vision, C stand for convulsion or constipation, D for dizziness or drowsiness, S for stasis of urine or retention of urine. And good news of atypical antipsychotic have a very few extrapyramidal syndrome. And more bad news for an atypical antipsychotic, we have to monitor patient for metabolic change. What does it mean? Metabolic change means patient blood sugar go up, we call hyperglycemia or diabetic mellitus type 2, dyslipidemia, and weight gain. So here, side and adverse effect of antipsychotic. Antipsychotic effect, anticholinergic effect, dry mouth, increased heart rate, urinary retention, constipation, hypotension. Or extrapyramidal effect like Parkinsonian problem, tremor. Also, mask-like faces, rigidity, a shuffling gait, also dysphagia and drooling, right? And also dystronias means abnormal involuntary muscle contraction, abnormal involuntary eye movement, including oculological crisis, facial grimacing. So the first generation antipsychotic, the most common side effect, extrapyramidal symptom or neuroleptic malignant symptom, agranulocytosis, anticholinergic effect like dry mouth, constipation, hypotension, and sedation. But atypical antipsychotic, most common side effect, as I told you, diabetic mellitus, weight gain, hypercholesterolemia, sedation, orthostatic hypotension, amenorrhea, sexual dysfunction, or agranulocytosis. What else? So, akasia means restlessness or constant moving about. Side effect, another side effect most common here for this group of patients, and these are tardive dyskinesia. It is involuntary movement of tongue, neck, and facial muscle, like lip smacking or tongue protrusion. Unfortunately, the patient who developed tardive dyskinesia, it is irreversible and persistent after discontinuation of medication. All patients on antipsychotics should be monitored for tardive dyskinesia and using abnormal involuntary movement scale prior to initiate the therapy and during the course of treatment. The other side effect and adverse effect like drowsiness, blood dyscreasis, photosensitivity, elevated blood glucose level, increased body weight, impaired body temperature, gynecomastia, and lactations. So what are the nursing intervention if my patient have this type of problem? So monitor vital sign, monitor for symptom of neuroleptic malignant symptom, right? Neuroleptic malignant symptom, as I told you, it is extrapyramidal symptom. So then monitor urine output, monitor glucose level, admin medication with food and milk to decrease gastric irritations. For oral use, liquid might be preferred because some client behind the tablet to avoid taking them. Note that absorption rate is faster with liquid form or oral medication. The skin contact with the liquid concentration is avoided to prevent contact dermatitis. Protect the liquid concentrate from the light and dilute the liquid concentrate with the fruit juice. The client is informed that a full therapeutic effect of medication may not be evident for 3 to 6 weeks after initiation of therapy. So they have to wait to see the effect of medication. However, the observable therapeutic response may be apparent after 7 to 10 days. The client is informed that some medication may cause a harmless change in urine color to pinkish to red-brown. Also reinforce the instruction to use of a sunscreen, hat, and protect the cloth when outside because this photosensitivity effect. So next, inform the client to avoid the alcohol or other central nervous system depressant. Also reinforce the instruction to change position slowly to avoid orthostatic hypotension. Reinforce the instruction to report sign of granulocytosis. So when your client is on an atypical antipsychotic medication, also monitor them for agranulocytosis, right? Agranulocytosis means low white blood cell, WBC. If they have agranulocytosis, they will complain of fever, body ache, chill, sore throat, basically sign of flu. The medication must be stopped immediately and it is very serious condition. So also reinforce the instruction to report sign of liver dysfunction, include jaundice, malaise, fever, and right upper abdominal pain. When antipsychotics are discontinued, the medication dose is reduced regularly to avoid sudden recurrence of psychotic symptoms. Monitor for extrapyramidal side and adverse effect in the client taking up antipsychotic medication.